The question here, the client is recovering from abdominal surgery and has a large abdominal wound. The nurse should encourage the client to eat which food that is naturally high in vitamin C to promote the wound healing. After the major abdominal surgery, a patient is the healing stage. Now they said vitamin C can help to healing the wound. So which food is contain the vitamin C more? First of all, they said in this question, they said about the vitamin C. So what is the normal function of vitamin C? Vitamin C in the body, they helps to tissue building or help in the metabolism or major which information here. NCLEX would like this question. Vitamin C help iron absorption, right? So what are the source of vitamin C? So here we go. Milk. Milk is a good source of vitamin D or calcium. Orange, yes, is a good source, right? Because orange, it is our choice. Let me see. And what are the explanation? So they said the citrus fruits or juices, even tomato, green leafy vegetables, and peppers are the source of vitamin C. They said the citrus fruits, juices, especially high in vitamin C. Banana high is potassium. Meat and dairy product are two food groups high in vitamin B. So what are the deficiency occur because of vitamin C? If anybody do not take enough vitamin C, deficiency of vitamin C can cause the scurvy. If the patient have a scurvy, they developed bleeding or joint pain or swollen gum. So also, let me recap it. So when deficiency occur of vitamin C, patient develop scurvy. So if anybody have scurvy, how we understand they have it? The symptom, easily bleeding or gum bleeding, joint pain, and swollen gum. NCLEX board, another question like to ask, if patient have iron deficiency anemia, we tell patient to take iron containing food. But if the patient take vitamin C with iron containing food or iron tablet, their absorption will increase. So also keep in mind, increase intake during the time of stress or illness. So if you undergo any illness or any stress, it is good if you take vitamin C. It helps to boost up your immune system. Smoker need more vitamin C for their nutritional balance. Question here, the nurse is caring for a client with a cirrhosis of the liver. The patient is diagnosed the liver problem, liver disease. And minimizing the effect of disorder, the nurse teach the client about the food that are high in vitamin B1 or thiamine. You can ask me why a liver disease patient need vitamin B1, right? Makes sense. And also the nurse determined that the client has a best understanding of the dietary measure to following if the client state an intention to increase intake of which food. So there are 4 types of foods or food. So which one content the vitamin B1 or thiamine, right? So B1 here. So milk is contain vitamin C, or milk contain good source of vitamin D and calcium. Chicken, good source of protein. They're the vegetables, broccoli, gas forming food basically. And last one, the legumes. The legumes contain the thiamine or B1, right? So the explanation here, the client with cirrhosis need to consumption of food high in the thiamine. Thiamine is present in variety of food of plants or animals origin. Especially legumes are especially rich with the vitamin B1. So first of all, let me explain. If any patient have a liver problem, we educate them no alcohol intake, no nicotine intake, no caffeine intake. And also they need vitamin and mineral supplement may be needed if patient have a liver disease. The vitamin B complex have some normal function in our body. They helps metabolism, they helps energy formation, also nerve functioning. The major source of B complex vitamin, basically meat, milk, or legumes, green leafy vegetables. If the patient deficiency of vitamin B1 or thiamine, patient develop the disease we called beriberi. And let me explain some deficiency of vitamin B complex. So deficiency of vitamin B1, other name of B1 is called thiamine. So if patient deficiency of thiamine, they develop the beriberi. The beriberi is common in those who are alcoholic. So alcohol use disorder person has impaired absorption of B1 vitamin and develop the beriberi. If anybody deficiency of B2, we call riboflavin or riboflavin. So patient develop the cirrhosis. Usually the little bit ulcer-like lesion in the corner of the mouth, or patient develop the glossitis. What is glossitis? smooth and swollen red tongue. If anybody deficiency of folate can result in neural tube defect in fetus inside uterus, or if anybody have a chance to deficiency of vitamin B12, the chemical name is called cyanocobalamin or simply cobalamin, they chance to develop pernicious anemia. So the person who is strictly vegetarian, so affect strict the vegan, and those lacking the intrinsic factor of Kessel in the stomach and need for absorption of vitamin B12. So intrinsic factor of Kessel is a one molecule important to absorption of B12. So if we have a deficiency of vitamin B12, chance to develop pernicious anemia. If patient has any defect in the stomach for intrinsic factor, also impaired absorption of vitamin B12, both cases chance to develop pernicious anemia. If patient has deficiency of vitamin C, they chance to develop scurvy. The person who has scurvy, the symptom is bleeding tendency, joint pain, or swollen gum. Question here, the nurse is providing discharge note about the dietary teaching to a client with a history of irritable bowel disease and shortly called IBS. Another disease is called IBD. They're two different. Irritable bowel syndrome, and another is called irritable bowel disease. So what common made by the client tell the nurse for further instruction is needed. So something wrong, I need to re-educate them. There are 4 options. My patient tells something wrong, I need to correct, right? So first of all, in case of IBS, so what we have to know for the patient? So basically, IBS patient, they have to avoid some fiber containing food. They have to avoid. Low fiber is good for them. So first of all, they said here, I will eat more beans and peas. So beans contain too much fiber, and too much fiber is not good for them because the motility of the gastrointestinal system is increased. They go more for defecation, more flatulence come, flatus come. So it is good to avoid. It is wrong. And I should eliminate the caffeine and alcohol. It is good idea. It is eliminate, no need. I'm afraid my son will get this disease. Yeah, it is a heritage disorder, genetically transmitted chances. So your patient is not wrong. I know I need to take vitamin and mineral supplement. It is right as well. Only this you need to re-educate them. So IPS, the client have a problem, excess gas formation, and would increase the distension and bloating that is accompanied by abdominal sound, also flatulence. produce. So legumes or beans or peas should be avoided. Also caffeine or alcohol also have to be eliminated from their diet. So American guideline, dietary guideline for Americans, when we educate our patient, we have give some ideas about it. Every patient who is healthy, they should eat 5 or more serving of fruits and vegetables per day. It's good. But according to the dietary guideline for Americans here. But what if our patient have any problem of diverticulitis or irritable bowel syndrome or irritable bowel disease, or if patient has a celiac disease, we can tell something special they need to follow about nutrition, what it is. Let me explain. Some of the disease in medical science, we have to know the nutrition for the patient. Like here, we are talking about the diverticulitis. So if our patient is diagnosed by diverticulitis, what are the nutritional information they need to know or we should know when we take care of them? If your patient have acute exacerbation of diverticulitis or diverticulitis, it is an inflammation of the colon or diverticula. So if their acute attack, we give them clear liquid diet and low fiber intake. It is recommended. Low fiber and clear liquid diet. But after inflammation is reduced, or when they are subside the inflammation, we give them high fiber diet and low fat diet is recommended. And also tell your patient who have diverticulitis to avoid seed type of food, to avoid popcorn, to avoid tomatoes and berries. Due to some unknown reason, NCLEX liked this question. If my patient is diagnosed by irritable bowel syndrome, shortly called IBS, and some books say IBD, irritable bowel disease, it is good to tell them a low residual food or low fiber containing food, but high protein, high calorie diet is recommended. Also, IBD patient, it is important oral replacement of fluid may be needed. And sometimes IBD patient need total parenteral nutrition may be needed during the acute attack of chronic disease. But IBD patient, it is good to tell them to avoid the nicotine. What else? If your patient diagnosed by celiac disease basically is the inability, the person who diagnosed the celiac disease, they are inability to digest the gluten. So it is good to avoid gluten containing food. Usually if the patient have the celiac disease, they complain diarrhea, steatorrhea, bloating, in sometimes abdominal pain. So nutritional recommendation is super important for them. So we tell them to avoid containing the gluten. NCLEX board asks, what are the food list contain the gluten, like wheat, rye, barley? So sometimes it is okay to eat dairy product, rice, corn, potato, eggs, fruits, or vegetables. It does not problem the celiac disease. And last one here, lactose intolerance. So if our patient diagnosed the lactose intolerance, it is good to limit the food contain the lactose, like dairy product such as milk, cheese, chocolate, pudding, and also good to suggest use of lactase enzyme, and this enzyme can help to digest the lactose. Question here, a client is being seen in the client for symptom of hyperinsulinism, means hypersecretion of insulin. If insulin secretion is more, patient tends to develop hypoglycemia. And hypoglycemia is dangerous than hyperglycemia, although hyperglycemia can cause diabetic. Like a patient is diagnosed with diabetics or hyperglycemia, you give them too much insulin and then glucose falls suddenly and patient develop hypoglycemia, and it is the life-threatening condition. You need to know how to control. So they said the nurse provide information to the client regarding dietary measurement for the condition. Which diet should be most appropriate to suggest the client? So this question about diabetics, about hypoglycemia, about hyperglycemia, if you have knowledge about all of this, it would be easy to answer. Number one, low fiber, high fat diet. It is horse choice, right? It is nothing related to this. Limited food intake to 2 meals per day. But patient is already hypoglycemic. So large amount of carbohydrate between 2 protein meals. Large amount of carbohydrate. No. Small frequent meal with protein, fat, and carbohydrate each meal. It is very organized. So many words connected by comma and also connected by conjunction and or. So in some time, if you difficult to answer, then go some clues like which is the biggest, which is the more information, which is the more word connected by defined conjunction or preposition. Sometimes it is words, most of the times word. It is the biggest one. And definitely you have a good sense about the nutrition. So this one we choose, right? So first of all, I said, if blood glucose level is dropped less than 70 milligram per dl, patient diagnosed the hypoglycemia. The hypoglycemia, if you not treated, patient go confusion and also go to the shock and they die, passed away. So nutritional intervention is very important if patient have a hypoglycemia. We provide them at least 10 to 20 gram carbohydrate, and also we recheck the blood sugar level. every 15 minutes. And after blood glucose level stable, provide a snacks with carbohydrate and protein. But it is the management of the hypoglycemia. But what else about this question? What are the rationale? The deficiency of hyperinsulinism is an excessive insulin secretion in response to consumption carbohydrate-rich food. And this leads to hypoglycemia. It is often treated with a diet that is provided for limited stimulation of the pancreas. Carbohydrate can produce a rapid rise in blood glucose level. However, carbohydrates are necessary in the diet. Protein do not stimulate insulin release, but protein and fat both is important to provide the calories, right? So for NCLEX board, we must know when we decide my patient is hypoglycemia, when my patient decide hyperglycemia, what are the symptoms of hyperglycemia or hypoglycemia, and what are the management of hyper and hypoglycemia. So here a short note about compare and contrast hyperglycemia and hypoglycemia. So if we see the blood glucose level is more than 200 milligram per dl, we call hyperglycemia. Whereas the hypoglycemia, if we see the blood glucose level less than 70 milligram per dl, right? So for NCLEX board exam, I like to request you to know the common sign and symptom for hyperglycemia and hypoglycemia. So in case of hyperglycemia, the patient usually complain the polyuria, polydipsia, and polyphagia, means too much urination, too much thirstiness, and too much dyspsia, right? Hunger. Also, patient has a special type of breathing which called Kussmaul respiration and fruity breath. So if you get the smell of their respiration, it should be fruity. Patient complain the headache, also decrease the level of consciousness, and also chance of develop dehydration. Sometime at the morning hyperglycemia develop due to the untreated overnight of hypoglycemia. So now question about the what are the signs of hypoglycemia patient. Usually the patient complain about the shakiness or too much sweating. It is called diaphoresis, or patient confusion and headache. Headache is common both hyperglycemia and hypoglycemia. If my patient has a chance of hypoglycemia, what are the nutritional intervention? So always we provide 10 to 20 gram carbohydrate, like 4-ounce juice or regular soda. And also we retest the blood glucose in 15 minutes. If it is still under 70 milligram per dl, repeat the carbohydrate, means 10 to 20 gram carbohydrate, or 4-ounce juices or regular soda. After blood glucose level have established, we provide a snack with carbohydrate and protein. Like this question, a small frequent meal with protein, fat, and carbohydrate. So carbohydrate helps to make a balance of hypoglycemia because our patient is a hyper secretion of insulin. But protein and fat, it can provide a good source of calorie, what my patient need.